With us now, Democrat Congressman Steve Cohen of Tennessee. Congressman, what's the point of pushing a program that's already been on the table? It has to some degree been rejected by the voters of Massachusetts, and for which there are not the votes in the Senate or the House. What's the point of putting it on the table?
I don't know that it was rejected by the people of Massachusetts. Massachusetts already has a health care program, and the fact is the people of Massachusetts like their health care program, which I think Senator Brown voted for.
Okay, so what's the point of putting it in front of the Senate and the House again? The votes are not there. So what's the point of putting it in front of the House or the Senate?
I don't know that the votes aren't there. They could be there through reconciliation, and reconciliation is a process that's been used in the past to pass several bills during the Bush administration and the Clinton administration.
You would do that?
It's a way to deal with issues.
You would recommend. You think we need it?
The fact is,
but you think we need it so badly?
We have to use reconciliation.
You think it's needed so badly that the Democrat Party would take that kind of risk, pushing it through? It's acknowledged to be pretty unpopular. You would take that risk of pushing it through?
I don't think it's really that. I think people don't like what happened with Nebraska and the way that the special advantage was given. That will be changed, and undoubtedly. There are other things that would be changed. I think people want health care. I think they want to see people not be denied coverage because of pre-existing conditions. I don't think they want their premiums to go up and this to eat more and more of our economy, which will continue to do. This is a job killer, the health care as we have it today. Without change, we'll lose jobs. It'll increase the deficit much, much more. Premiums are going up. Deductibles are going up. It's costing small business a lot of money and costing people.
Scott Brown said very explicitly, look, a vote for me. Scott Brown said it. It was very clear. A vote for me and I will stop this health care. He was elected by a significant margin.
But but it was the polls show that people wanted the health care they had in Massachusetts, which is like the health care the rest of the 49 states would get from the Senate bill, which we'd have to pass with some changes. And the people of Massachusetts just wanted to keep their own health care. They weren't against what the Senate bill has. They didn't want to change from Massachusetts had. The other 49 states deserve to have a change and something good. And we need to take away the antitrust exemption that the insurance companies have today.
Okay. Are you playing politics here? Are you pushing forward a plan and expecting the Republicans to say no, and then having the Republicans painted as the party of rejection, refusal, and do nothing? Playing politics?
No, I'm hoping they'll come to the table. I hope they'll join us particularly in doing away with the antitrust exemption.
If they came to the table, let me just ask a question. If they came to the table and said, right, you give us real tort reform, would you listen to that? Would you talk about that?
I certainly would. I don't know what the definition of real is. That's an adjective. But I think there was something in the House bill about tort reform. My state of Tennessee has reduced tort cases by about 2/3. And that's something we put in the House bill. And I would like to see something put in there that people have to have a panel approve any actions they bring. You know, as we speak today, Representative John Murtha died. And he was my friend, and he served this country for many years, longest-serving congressman from Pennsylvania and a Vietnam War veteran. He died because when he went in for gallbladder surgery, his intestine was perforated. And that shouldn't have happened. It was, from what I understand, malpractice. And somebody who loses their life because of medical fault should have a court system that can give damages depending on what the person's life expectancy was and the loss. And the loss of John Murtha is great.
Forgive me for bringing this up. So you brought it up, but are you suggesting that Congressman Murtha is a martyr in the cause of health care reform?
No, in no way. Nobody's a martyr, but the fact is he went in for gallbladder surgery and they perforated his intestine. And that happens to other people around this country. And so you should not have some form of tort system to reward people or their families who are injured, and that's also a way to stop medical malpractice because people are more likely to be aware of those problems and be more careful. The system is not just to reward, it's also to protect.
I just have to say that a recent poll says 47% of voters want you to start from scratch, not go with the existing plan all over again. That's the latest poll. Congressman, I'm sorry, we're flat out of time, but I appreciate you being with us, sir. We do appreciate it indeed. Thank you, sir.
I just want to say, after listening to your previous interview, I'm going to get on the John McCain for re-election team.
Okay, thanks very much, sir. Appreciate it.